health disparities have always existed for the African American community.
Fox 26 is your station for health, family, safety, for money. COVID-19 affecting all of this and so much more, and minorities seem to be in the crosshairs.
It's shining a bright light on how unacceptable that is. They are suffering disproportionately.
But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19.
Tonight, we are talking about the challenges, the resources, and the action taken to keep the Houston area as safe as possible and come out of this crisis together. Houston strong, Houston proud. Our Fox 26 News special, COVID-19 Impact on Our Community, starts now. And good evening, everyone. Thanks so much for joining us tonight. I'm Jonathan Martin.
And I'm Caitlin Monty, and we are in the thick of this pandemic, working as a community to slow the spread of COVID-19 in order to save lives. And we know so often at this time of night, we're giving you the total cases, the number of deaths. But what can be lost in those statistics is the human toll that each individual loss causes to the families and the loved ones who knew them. And tonight, Fox 26's Donnelly Keith paints that picture for us, showing us the impact through the story of one of the Houston area's first COVID-19 patients.
88-year-old James Campbell was rushed here to St. Luke's Hospital in mid-March. He tested positive for COVID-19, and by the end of the month, he died.
It's been really, really hard.
Hard because not only did this new virus take 88-year-old James Campbell from his family, novel coronavirus took away their chance to share his last days alive.
You're not there to hold his hand, to see him, and to just be there, and literally he died by himself.
Campbell was a church deacon, a World War II veteran, and oh so giving. In fact, the dedicated husband and father almost gave his only son his name.
My mom wanted me to be a junior, but my dad's middle name is Cleophas, and she says, I'm not naming my son Cleophas, so I didn't get the C, but I got the T.
James T. Campbell says his dad taught him and his four sisters to be civic leaders.
If you want to, make a difference, you have to be the difference in your community.
In fact, as African Americans are infected by COVID-19 at an alarming rate, Campbell hopes his dad's story will help change that.
I don't want to see our community own COVID-19 like we did the HIV epidemic.
The elder Campbell suffered high blood pressure and diabetes. In mid-March, he began struggling to breathe, and an ambulance rushed him to Houston's St. Luke's Hospital, where the family was devastated to leave him alone, isolated, diagnosed with COVID-19. Then someone came along who was like a guardian angel.
One nurse who took down the names of all of his kids and went and prayed with Dad using our names.
After 8 days on a ventilator, the 88-year-old passed away March 31st.
We couldn't even go over to my mom's house and hang out with her to console her. This is a woman who lost her husband of 68 years, and she has to suffer that almost in isolation. But we didn't gather for my dad's funeral because of COVID-19. And so we were in a dark and dreary funeral home, 15 miles away from the church where the minister was doing the eulogy in an empty church.
Campbell says when this health crisis is over, he and his extended family will properly honor his father the way he deserves.
We're going to celebrate him as a family.
Results came back last week for the rest of the family, and no one else tested positive for COVID-19. In the Texas Medical Center, I'm Donnelly Keith, Fox 26 News.
Well, it is so real and so heartbreaking for so many families. And we know that the Campbell family certainly is not alone in suffering tragedy from this virus. In fact, the monster virus has affected communities, especially minority communities in areas like New York and New Orleans and beyond. Let's check in with Isaiah Carey. He's live tonight with more on that. Isaiah?
Well, Jonathan, we know here in Houston and in Harris County, we're in a race to get a handle on this deadly virus. And we're doing that by doing testing sites and also hand washing and social distancing as well. But the news from around the country in major cities is not good when it comes to the minority community. New York City, the epicenter in the United States for COVID-19. Hispanics account for more than a third of the deaths. They represent 20% of the population. Chicago sounding the alarm last week.
And Roger, can I have your next position after 170 East?
The black community accounts for close to 70% of the city's deaths. Detroit, 80% of its population is black. 40% of Michigan's deaths are from the city. And the entire state of Louisiana, 70% of the death rate there falls within the black community. Health issues among minorities, a huge factor.
The diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate.
We know that African Americans are more likely to live in densely populated areas, also in urban centers and in multi-generational households. They are also more likely to be considered part of the essential workforce. So we've heard a lot about African Americans being overrepresented among workers such as nurse aides, grocery store clerks, sanitation workers, emergency dispatchers, and also workers in public transportation system.
So the question is, can Houston follow that same deadly path, or will we become a model and buck the system right here? That's the question we have for you, Caitlin.
Well, Isaiah, Houston and Harris County officials are working very hard to try to give us more data, we as the public, so that we can have a clearer picture of how this virus is impacting our community and how it breaks down. And right now, we know that Harris County has had more than 1,600 cases and 29 deaths. We know the city of Houston is reporting more than 2,200 cases and 23 deaths. So a total of 52 deaths, and of them, 19 were white, 18 were black, 12 Hispanic, 2 Asian, and 1 was not specified. But that means that 35% of these deaths have been black or African American, when that population only represents 19% of the overall Harris County population. Now, while the numbers are small and thus the margin for error could be high, it's a discrepancy that local leaders are very much paying attention to right now. And tonight, Fox 26 anchor and medical reporter Melissa Wilson is taking a closer look at why these disparities could exist and the possible solutions to reduce these numbers.
I know all the information can be overwhelming, but we want to spread the important message. There are things we can all do right now to help prevent COVID-19, especially African Americans.
In the African American community, it is well known that we have higher rates of chronic diseases such as cardiovascular disease, high blood pressure, asthma, diabetes, etc. And that puts us in that high-risk category.
Dr. Sid Charisse Williams wants you to understand it's not COVID-19 that's so deadly, but your own immune system's response to it. She believes many African Americans have a low immune system because of a vitamin D deficiency and poor nutrition.
And we get natural vitamin D from the sun. And if I have darker skin tone, I'm not going to be able to get that natural vitamin D conversion in my skin. Now my skin is darker, it's great, it protects me against cancer, but I'm gonna have less vitamin D production. And so if I have less production of vitamin D, naturally, and my diet's deficient, I might need to take some additional vitamin D to help me with a deficiency or even help prevent chronic disease and illness.
Dr. Williams says vitamin D, known as a sunshine vitamin, regulates every cell in our bodies. She believes since African Americans typically have lower levels of it, it's leading to higher levels of chronic disease, also lowering the immune system and not protecting them from the devastating effects of COVID-19.
We have to think about prevention. Prevention is the best treatment and cure. And so the point is that we actually have more control than we think because we control the strength of our immune system.
That's why she suggests a high-quality vitamin D supplement like D3. She also believes everyone should change their mentality to consider food as preventative medicine and eat to provide nutrients to your body.
Can they really do these changes and make a difference and perhaps prevent it if they start working on their immune system right now today?
Absolutely, because every day counts. It's never too late. If your diet is bad and you know that it's not as sufficient, then you just start today putting your health as a priority and your family's health and say, hey guys, we're not going to eat the processed foods. Let's cook at home. Let's have vegetables. Let's have fresh fruits and things like that to actually start reversing some of the nutritional deficiencies.
Dr. Williams also wants you to do your best to control your fears about coronavirus because that can lower your immunity. And then the last two pieces of the puzzle, make sure you get plenty of sleep and proper exercise to boost your immune system. Reporting from my home, Melissa Wilson, Fox 26 News.
They're absolutely capable. I mean, it's just a device that's missing, you know?
Still to come tonight, no school, no access to education, how some schools are coming through for underprivileged children. You're watching a special edition of Fox 26, COVID-19 Impact on Our Community. We'll be right back.
Hey everyone, I tested positive for COVID-19. I was one of those people like, this can't happen to me. Black people don't die from this. The numbers just weren't supporting it in the beginning. I was wrong. This is so very real.
I am a survivor, like I mentioned. I spent 9 days in ICU. This was something that came upon me quickly. I know there were a lot of myths and rumors out there that African Americans couldn't catch it, but I'm a living witness that you can catch the virus. And I want to encourage everybody to listen to the medical professionals, listen to the local leaders, that we need to do everything in our power to stay safe.
Welcome back, everyone. Well, about 20% of all Latinos here in Houston live in poverty. And tonight, our Maria Salazar is looking at how income inequality can impact education, especially now with so many students having to learn from a distance.
About 60% of all students at Ama Sanchez charter schools do not have access to a computer, the internet, or both at home. The school and donors are stepping up to close that digital divide.
Concerned about her eyes because she had her phone here, and I was like, Giselle, is that how you doing her? And she was doing Microsoft Word too.
When Ama Sanchez charter schools were forced to move to online learning, Giselle Cantu had internet at home, but not a laptop. About 2 weeks ago, her school was able to provide one.
Before that, I was emailing teachers to see if they can send me their work through my email so I could print it out.
Now that she's got what she needs, Giselle says she's already a week ahead and likes online learning.
I'm able to do my assignments, complete them faster.
They're absolutely capable. I mean, it's just a device that's missing, you know?
Margaret Rodriguez, superintendent for Ama Charter Schools, says so far they've been able to secure about 400 laptops for students. She's proud of the students who are finding ways to get their work done, even if it means logging on late at night.
They can't log on at the same time because they're siblings.
Between the two campuses, there are roughly 1,000 students. 98% are Latino, 89% are considered economically disadvantaged. And right now, most of their parents are without work.
We have pre-K 3 and 4, and in polling those parents specifically, about 90% of them are in service jobs.
The first round of laptops were for households with internet. Next up, we'll be helping those without it.
That is a challenge. I think Chromebooks have been scarce as of a couple of days, and hopefully everybody's getting their inventory back along with hotspots.
They hope to secure 100 more laptops by early next week. Maria Salazar, Fox 26 News.
My mom started showing symptoms, and at first we just thought it was her allergies, but then it got worse. So we took her to go get tested, and she tested positive, and it was just very scary because we thought we were being safe. We thought we were taking all the precautions, and we were, but she still got it, and it was very scary. It was also very stressful because I just didn't want it to get worse.
We at Fox 26 are continuing to bring you the voices of those who've been impacted by the virus. But tonight, Fox 26's Isaiah Carey brings you his conversation with one of the people who was selected by the people to represent our needs as a diverse community.
We have seen an increase in the number of deaths involving African Americans across the country.
We have found that in a city such as Houston, Texas, we're 23% of the population, yet we're 46% of the deaths. And this also applies to a good many other places around the country in terms of being a higher percentage of deaths. I think that this is because this disease tends to exacerbate pre-existing conditions. And these conditions are, of course, heart disease, lung disease, cholesterol, high cholesterol, as well as hypertension. But I do want to say this. Sometimes we have to look at the root cause of these problems. And these diseases are all rooted in systemic invidious discrimination. This discrimination is something that has been with us, and at some point we have to look at the root cause and deal with it. My hope is that we will continue to push for health care for all. We want to make sure that we have everybody to have equal access to good housing so that some people don't live in polluted neighborhoods.
We also had a chance to speak with Congresswoman Sheila Jackson Lee on the issue.
Actually standing at Cullen Middle School, as you well know, we opened up this testing site just a day ago, and the lines are continuously coming. We said that this was a neighborhood testing site that would cover Southeast Houston, including South Park and Third Ward and Sunnyside and beyond. And part of that, and the one that we opened at Forest Brook and the one on TC Jester, 510 TC Jester, is reflecting that putting sites in neighborhoods is indicative, if you will, of the great need to be able to test in vulnerable communities. And what we have heard, of course, is that the basis of the disparities is because people of color, African Americans, have underlying conditions. I think it is crucial for us to emphasize the facts, and that is that African Americans, people of color, die disproportionately.
Welcome back. All right, and that was our Isaiah Carey reporting there. Well, even with Texas now extending its freeze on evictions until at least April 30th, many families are telling us they are still getting eviction notices for not paying their rent. So what's happening here? Our consumer reporter Heather Sullivan did some digging and is looking into this tonight and has some smart sense for anyone who's in this dilemma.
It's causing a lot of mental stress and anguish. It's causing me to not be able to sleep at night.
Sleepless nights for Millhouse and Kayan Dixon.
Not getting any rest, and we pay good money for these apartments to live in, you know.
Like so many whose jobs have been cut, they say they can't pay the rent this month and got this notice from their landlord to vacate.
The part that was so stressful to us is that it states that we need to be out by April the 13th, which was yesterday.
But Lone Star legal aid lawyer Nick Whitaker says a landlord's notice to vacate is legal, even though the Supreme Court halted eviction hearings until April 30th.
So a landlord may still issue a notice to vacate, and they may actually still file a lawsuit with the court, but that lawsuit will not be processed or given a court date until after April 30th.
A tenant can either move out or go to court when the moratorium is lifted. But Whitaker recommends that a tenant try to reach a payment plan agreement in writing with the landlord.
Because while they can't go to court right now, they can go to court about your late April rent whenever the moratorium is lifted.
Mel and Kayan say they now hope their landlord will accept a payment plan so they can stay in their home.
As my biggest fear was possibly a big lock being put on the door or being thrown out, and we just didn't know what to do.
With Sullivan Smart Sense, I'm Heather Sullivan, Fox 26 Houston.
And still to come here on Fox 26, we have an update on all the local testing sites for COVID-19. Well, we want to remind you that the City of Houston is now allowing anyone to visit any of their City of Houston testing sites, regardless of whether you have symptoms. You may go. You still need to call or go online first. And there are a growing number of places in our area that have free testing or testing available. Today, Harris County opened 2 mobile pop-up sites that are going to rotate daily through various locations throughout the county. And tests are also available at United Memorial Medical Center on West Tidwell, Forest Brook Middle School on Tidwell Road, and testing is available at Del Mar Stadium and Butler Stadium and at Smart Financial Center in Sugar Land. Galveston County has testing on Emmett Lowry Expressway in Texas City, and we have all testing information on our website. If you need to find it, just visit fox26houston.com. But we want to thank you for joining us.